English, Telugu?
English, sir.
English, yeah? Normally,
Sir,
how many seats?
this live session, sir. Normally 15 to 20 people will be there.
15 to 20.
Like later we will be sharing it across, and then the views come around 60,000, 70,000
Huh?
views. Yes, sir. Like once. Namaste viewers, welcome to the Facebook live session. Today our topic for discussion is, are heart diseases common in women? And for our discussion we have with us Dr. A.Sreenivas Kumar, Senior Consultant Cardiologist at Apollo Hospitals, Jubilee Hills, Hyderabad. Dr. Sreenivas Kumar has an experience of over 20 years in managing patients with various heart problems. He is the Director of Cardiology and Clinical Research for Apollo Group of Hospital, Jubilee Hills. His areas of expertise include coronary interventions, mitral balloon valvotomy, and the structural heart interventions. Welcome, Doctor, to our Facebook live session.
Namaste.
So, starting with our questions. So, the first question is, sir, what are the risk factors for coronary artery disease?
Yeah, generally in India we see heart disease at two peaks. One is we see heart attacks happening in younger individuals, and that is somewhere around 40 years of age, 40 to 45. The second thing happens happens in the elderly population, that is after 60 years or so. In the younger subgroup of patients, the commonest risk factor is stress and smoking, and generally if people want to achieve more and more, keep very high targets, things like that leads to a lot of stress, and also smoking, and not only smoking, anything related to tobacco, gutka chewing, all that would be important in young people. And whereas heart attacks which happen after 60 years of age generally are secondary to the standard risk factors which we know are called as diabetes, that is high sugar levels, and blood pressure, hypertension, blood pressure values being more than 140/90, high cholesterol levels. Then if your patient becomes obese, person is too much obese, lack of exercise, idealness, all that are also risk factors for development of heart attack. So if you have to see, with increasing age also, the risk of getting into trouble increases, and the male sex is also slightly more prone for heart attacks compared to females. But once females achieve postmenopausal stage, the risk would become same almost like men. So there are some modifiable risk factors, some non-modifiable risk factors. Modifiable one is what I mentioned, the standard diabetes, hypertension, smoking, etc. Non-modifiable ones are age and sex.
Okay, doctor. So, what should I do if I have risk factors for coronary artery disease?
Actually, if you unfortunately develop risk factors, then there are very good medications to control risk factors. If you have hypertension, you have good medicines to decrease blood pressure. If you have sugars, we have very good medicines to decrease sugars. And obviously, if you are smoking, then you can quit smoking. And if you are obese, you should do exercise, walking, and decrease your weight. And if you are too much stressful, practice yoga, meditation to decrease stress. All these would help you to control your risk factors. The beauty of controlling risk factors is, once you control the risk factors, the risk of getting into trouble like heart attack and paralysis significantly decreases. And people should also be aware that apart from taking the blood pressure tablets and diabetes tablets, taking small dose tablets of cholesterol lowering tablets like statins also would help to decrease the risk of getting into heart attacks and strokes.
So what dietary changes can I make to reduce my heart disease risk?
As somebody said, if you can control your diet well, the significant proportion of heart diseases can be controlled, or at least we can prevent them from happening. But what to eat, many of us know, but the difficulty is in practicing. Many of us know that anything eating cheese, pizza, burgers are not good, sweets is not good, but we tend to take it because of negligence and our not to the sweet, lot of likingness towards those foods. But generally, you should take more of salt, salads, vegetables, and less of salt. And goat-like diet, if you have to remember, vegetarian diet is good. Non-vegetarian, occasionally, probably you will take fish, it's good for heart, but generally you tend to avoid red meat, and then probably if you have to take chicken, remove the fat, and occasionally you can take. But by and large, vegetable diet is good. Take more of salads, vegetables, sprouts, and things like that. Some people have the habit of taking nuts. They're also okay, but anything is there, you should take in moderation. In Sanskrit, there is a saying called Ati Sarvatra Varjit. Anything taken in excess is not good. And a lot of other people, viewers also want to know which oils are good. Generally, now the data shows that the rotation of oils is good. So any type of oil, if you're taking probably once in 2-3 months, you can rotate the oil. But by and large, for people to know, olive oil is supposed to be good, but it's very expensive, not very tasty. That's why not many people can use it. Apart from it, then probably if you can use sunflower oil, safflower oil, or canola oil, these are okay. Avoid refined oils, avoid groundnut oil, which again, never ever use recooked oils. Don't reheat the oils and use it, because that leads to hydrogenation, and many times cancer causing chemicals are grown in it. So anything, again, you use whatever types of oil in moderation is good, and rotation of oils is good. So these are some of the dietary precautions which will help us to get into trouble.
So how does a woman know if she has any heart problem?
Whether it is women or men, generally, whenever somebody gets a discomfort in the chest, which can be anywhere from the jaw to umbilicus to both hands, whenever it happens on exertion, and you can walk faster or you climb up stairs, you get sort of discomfort which is diffuse in nature. And then when you take rest, the heart rate decreases, and then the discomfort which you get also decreases. And whenever you take sublingual sorbitator on the tongue, again the pain decreases. If somebody has all these three typical characteristics, we call it as typical angina. If it is two characteristics, it's called as atypical angina. If it is one or none, it is non-anginal pain. So, diagnosis of heart disease is predominantly by symptoms like angina is a manifestation of inside heart disease, blocks developing in the coronary arteries. Sometimes it may not be chest pain classical, you could get only breathlessness, which could be called as anginal equivalent. Sometimes people get palpitations and syncope as a manifestation. So, but by and large, any complaint which is happening on exertion should make sure that you are not having any significant heart problem. And then once you have a suspicion, then if you go to facilities like Apollo, and cardiologists generally see and evaluate further and do an ECG, echocardiogram, and if required stress test to diagnose any minor heart diseases also. Once any of these evidence that there is heart disease, then you proceed further to either doing a CT angiogram, an angiogram, which is the final gold standard to diagnose the blocks in the blood vessels of the heart.
So what are the signs of an unhealthy heart?
As we said before, a heart normally has the functions of pumping and ejecting blood to all parts of the body. It also fills itself with the coronaries. So whenever it fails to do this job, then the blood supply to the organs and other parts of the body decreases, and patient starts developing fatigue. And then suppose the blood supply to blood vessels of the heart also decreases, he starts developing discomfort, which we call as angina. So whenever you have these sort of complaints, that is an indication that your heart is not well. So when such suspicion is there, if you go to doctor, if you do some tests, if the ECG or echocardiograms come up normal, then you will know that your heart is not healthy. But by and large, a person of whatever age he is, there is some required amount of exercise which he is supposed to do. For practicality, if you 220 minus age in years is what is the heart rate which you should achieve on exertion. At least 80%, 85% of that heart rate if you can achieve when you're exercising, walking, jogging, swimming, then that means your heart is reasonably healthy. But if you're not able to do that, then probably your heart starts becoming sicker, and then if disease increases further, even with minimal walking, even at rest, sometimes you start becoming breathless. So those are the signs of to indicate that your heart is not healthy.
So coming towards our next question, So how does menopause affect the heart?
As I said, normally women are protected before menopause compared to men from getting into heart attacks. That is basically happens because of hormonal changes which are there in the premenopausal woman, like prostrogen, the estrogen, progesterone, are supposed to be projecting or protecting the blood vasculature and also supposed to be preventing the development of atherosclerosis within the coronary arteries, that is the blood supply vessels. So once the post-menopause happens, then the production of these hormones decrease, and then the beneficial effects of vasodilatation, endothelial dysfunction prevention, all that will go away, and then that's how their risk becomes equal to men. So on the other hand, if patient is having diabetes, then as a risk factor, then even before menopause also, the protection of the hormones gets nullified, and then the risk in premenopausal women if they have diabetes also is same like men. So be aware that once you cross menopause, your risk of getting into trouble increases. So you should immediately go to a nearby doctor, cardiologist facility, and evaluate your heart once.
So how can a woman take care of their heart after menopause?
Like what we said is a general following lifestyle measures with the appropriate diet, with as diet prescribed as discussed before, and then probably maintaining reasonable exercise, at least 30 minutes of brisk walking, at least 5 days in a week. That means 150 minutes of exercise activity, and then eating healthy food and doing yoga, meditation like that will help you from getting into trouble. And again, one more most important thing is a happy heart is a healthy heart. Don't keep on cribbing, don't stress yourself too much on various abnormalities which exist around you. Nothing can be 100% perfect. Accept what it is as a reality and don't stress yourself too much. And if you're happy without stress, that also goes a long way in preventing heart problems. And after menopause, you feel sometimes you're getting time is over, age is over, you get tends to stress up more, then you also tend to get into trouble, which should be avoided. Yoga, meditation help in a long way in preventing problems which could happen after menopause. Unfortunately, if any of you develop blood pressure, diabetes, high cholesterol, we should take tablets according to doctor's advice and prevent from developing into these heart attacks and paralysis.
So what causes heart palpitations during menopause, and can menopause cause heart arrhythmia?
As discussed before, the lack of hormones immediately after menopause and imbalance which happens with estrogen, progesterone, and then other associated changes in various types of hormones like renin-angiotensin system and then adrenaline, noradrenaline things. Lot of chemical imbalances could happen, leading to either increased heart beating or sometimes decrease in heart beating or sometimes ectopic beating or irregular beating. Some of the times this also could be associated with increased thyroxine levels or increased adrenaline levels, which could lead to this faster beating of the heart. Other common cause, which is more physiological, I would say, is because of decreased blood supply or decreased blood in the hemoglobin concentrations of blood, which is called as anemia. That could also lead to faster heart beating, which is manifested as palpitations. So when somebody is facing palpitations or awareness of heartbeat, you should evaluate whether it is regular abnormality or irregularly beating. Irregular ones could be because of disturbance in the heart, current system of the heart. They are generally called as arrhythmias. So whether it is a physiological problem or a pathological problem, once the doctor evaluates and takes an ECG and gets echo and stress test, we will be able to tell you. But by and large, you should not be worried with minor palpitations or minor postmenopausal heart flushes. They could be normal because of hormonal change. But whatever it is, whenever you have doubt, go to the nearest doctor, get yourself evaluated before you land in trouble.
So coming towards the end of the last question, can menopause cause angina?
Yeah, as we said before, before you get into menopausal age, you have some protection because of hormones. But once you get into menopause, the beneficial effects of hormones is lost, though your chance of getting into heart attack will become equal to men. So whether men do get angina or not, the same is the case with females after menopause. So it depends upon family history, it depends upon presence or absence of other risk factors like diabetes, blood pressure, high cholesterol, how much active the lady is, how much weight she is maintaining. All that depends upon development. It leads to development of atherosclerosis and angina. So if you say postmenopausal status leads to angina, it is indirectly yes, But I would say it the other way, the beneficial effects of premenopausal state are gone. That's how your risk becomes equal to men.
So coming towards our audience questions, can low estrogen affect your heart?
Yes, that's what we were discussing. The low levels of estrogen and progesterone, which happens post-menopausal state, leads to trouble. More than estrogen, actually, low levels of progesterone are supposed to be more bad for the heart because it's supposed to protect you, and vasodilatory benefits are not there. So the people will tend to get into vasospasms, people tend to get into clotting phenomena, people tend to get into heart beating abnormalities, arrhythmias, so on and so forth. So these all could lead to heart trouble.
So can can menopause cause chest pressure?
Yeah, that's what we discussed. Angina, chest pressure could be same. We already answered this question.
So when should we worry about the chest pain?
Yeah, as is very important, before we close, all the viewers should be aware of what sort of pain could be heart pain. Like any discomfort which happens from the lower jaw to the umbilicus or to both of the hands in the whole chest, especially when it is happening more on exertion, increases with exertion, climbing up steps, walking, decreases with taking a rest or taking sublingual nitrate. This is a characteristic feature of angina or heart pain. Please be aware. On the other hand, if a pain is very local, focal, it is happening in one finger pointed at one particular point, it doesn't change with exertion, present throughout the day, doesn't change with eating habits, doesn't consistently, it is the same, then it is unlikely to be heart pain. So by and large, anything happens in exertion, should be careful.
So the next question is, what does blocked artery means?
Yeah, as we said, atherosclerosis is a process in which a cholesterol plaques develop within the blood vessels. So as the increase in severity, initially it will start as a small fibrophatic plaque, then it becomes 20%, 30%, then the 50%. That means if you see the overall lumen of the arteries like this, how much percentage of the area gets blocked? That is what is the plaque nature. If it is about 70% plus, it starts getting symptoms when the person exerts, and if it further progresses, it could become 90%, and over which if the plaque ruptures and suddenly the blood vessels within the blood cells like platelets and then probably fibrinogen and other materials get clogged there and forms a clot. That's where arteries get 100% occluded. That's what is generally in colloquial terms measured as clogged arteries. But when such a thing happens, patients develop heart attack, and we should always aim at preventing the total block of these blood vessels so as to prevent heart attacks.
So what are the typical presentation of heart pain in females?
Yeah, typical presentation is what is generally mentioned as I mentioned, like chest discomfort happening and exertion decreasing the rest. But in females, what is described is atypical presentations of heart attacks. It did not present as a classical chest discomfort. Sometimes they could get just breathlessness, or sometimes they could just get fatigue, weakness, and sometimes they just develop palpitations and syncope, or pain characteristic presentation location sometimes could be different. And these are something called as atypical presentation of angina or heart attack, which could happen in females. So females are always special, and any sort of discomfort, especially happening on exertion, you should, wherever it is happening, whatever type it is, and any other complaints apart from pain, you should always try to rule out whether it is related to heart.
So what are the diet precautions to take care of our heart after one crosses 40 years of age?
Yeah, dietary precautions, as we mentioned, the healthy lifestyle, the dietary habits should be kept. More of vegetarianism is good, and eat anything you eat in moderation. Anything you eat tons of it, then it is bad. Then don't take too much sweets or fats, and try and take more of salads and vegetables. And the carbohydrates are also not that good. So generally, vegetarian diets are preferred. And if you have to take nuts, probably walnut is good, almond is okay, and then kaju is not that great helpful. But anything you eat in moderation. And nature's way of protection, or whatever you call, all the tasty foods like cheese, pizza, burgers, and then biryanis, all that are not good, healthy, not healthy, and then anything like vegetarian salads, sprouts, which are less tasty, could be more healthy. Then some exceptions to this rule are fruits, which are tasty as well as healthy, provided you keep your calorie content in view. And chocolates, again, some dark chocolates are supposed to be having antioxidants, which could be tasty as well as healthy. But again, you eat tons and tons of chocolates, then your calorie content goes up, and you become obese, and again all the ill effects of sugar and other things start. So you should keep that in mind, and occasional intake is okay.
So coming towards our last question, doctor, please tell our audience about the facilities provided at Apollo Hospital, Jubilee Hills.
Yeah, this is a great question and a great concept. What Apollo Hospital management wants to promote is a concept of pro-health. That is, don't come to hospital after you suffer a heart attack and get stents done by us. That anyway you will do it, because obviously when you are without coming, you die at homes. So what we want is to promote this concept of positive health, not the negative way of prevention of heart attacks, but avoiding heart attacks altogether. And then probably more and more newer concepts coming up in our prevention aspects is what is called as primordial prevention. So if you don't develop high blood pressure, don't develop diabetes, don't develop high cholesterol itself, so the risk factors won't come, then obviously heart attacks and paralysis won't come. Thus this prevention of concept of risk factors itself is called as primordial prevention, which we all encourage everybody, all the viewers, to follow. So when we should start it, the earlier the better. Now patients who have positive family history should start it right from school age. Even in general also, the earlier you start all this yoga, meditation, walking, healthy diet habits, it's always good. So to encourage this positive approach, and Apollo Hospital started what is called as pro-health concept, in which once you come, get your cholesterol checked, sugars checked, and blood pressure checked, and if any other abnormalities come, then the concerned specialist look at you and then probably advise accordingly. And once, even if you come, if everything comes normal or abnormal, if abnormality comes, accordingly the specialist will see and take care of you. If any minor ailments are there, if you are totally healthy also, you want to continue. Apollo stays as your friend for 3 years down the lane with this concept. On the same day, next year, some of our paramedical staff will call you and appraise you if you have any problem. And if you have any troubles, anytime you can have a faster consultation with our consultants. And again, any unfortunately if you develop risk factors like blood pressure, diabetes, cholesterol, we should take advice as well, the specialist advice, and take tablets and treatment. And by positive promotion like this, and positive thinking about good health maintenance, diet, yoga doing, you can prevent the occurrence of heart attacks. And that's what is a positive health concept, a pro-health concept of Apollo, which we request all the viewers to take a note. And the tests, which are generally very expensive and cost about 10,000 plus, are done all in a lesser price of approximately 3,000 or so. And but please be aware of this concept and get your heart checked and maintain your hearts healthy. Thank you.
Dear viewers, we have come to the end of our session and hope we have covered all aspects. If you still have more doubts, you can book an appointment with Dr. A.Sreenivas Kumar and clarify your doubts. Thank you, Doctor, for educating our audience in today's session. Thank you for joining us. Stay tuned for more such educative live sessions. Namaste.
Namaste. All the best, viewers.